Fentanyl, a growing shadow. Imagine a drug so potent that a pinch smaller than a grain of salt could be deadly. Welcome to the world of fentanyl, a synthetic opioid that has quietly become one of the most lethal drugs in the opioid epidemic. Today, we delve deep into the story of fentanyl addiction, exploring how this drug impacts individuals and communities and what can be done to combat this devastating crisis. The rise of fentanyl. Fentanyl, originally developed for pain management treatment of cancer patients, is a powerful synthetic opioid, similar to morphine, but 50 to 100 times more potent. In recent years, its misuse has skyrocketed due to its cheap production and powerful high. It's often mixed with heroin or cocaine, which significantly enhances potency and potential risks. The drug's accessibility has led to unprecedented levels of addiction and fatalities, overwhelming communities and healthcare systems across the globe. Fentanyl acts on the opioid receptors in the brain, significantly altering pain perception and resulting in intense euphoria. This makes it not only an effective painkiller, but also a highly addictive substance. Its potent effects are due to its high fat solubility, allowing it to cross the blood-brain barrier more quickly than other opioids. The grip of dependency. In the short term, fentanyl can cause extreme happiness, relief from pain, and sedation, but it also carries risks like respiratory depression, unconsciousness, and death from overdose. Long-term use of fentanyl leads to increased tolerance, severe withdrawal symptoms, and a range of psychological effects including depression and anxiety. The journey into addiction often begins unwittingly. Many victims of fentanyl addiction start with legitimate prescriptions or by using drugs laced with fentanyl, unaware of its presence. Once the body experiences the euphoria associated with fentanyl, it begins to crave more intense and frequent doses, leading to a rapid and dangerous dependency. For those ensnared, obtaining and using the drug often becomes a central focus of life, sidelining health, relationships, and responsibilities. Prescription practices play a crucial role in the rise of fentanyl misuse. Overprescription, lack of proper patient education about the drug's potential for dependency, and inadequate monitoring of patient usage contribute significantly to its abuse. This chapter investigates how changes in prescribing habits, coupled with increased awareness and stricter regulations, could reduce the incidence of fentanyl addiction, the lethal threat. At the height of the fentanyl crisis, the dangers become palpable. The drug's high potency not only makes it highly addictive, but also incredibly deadly. Even a minor miscalculation in dosage can lead to overdose and death. Emergency rooms across the country report increasing cases of overdoses, many requiring life-saving interventions with medications like naloxone. The climax of this crisis is a stark, painful reality where daily fatalities are not just statistics, but sons, daughters, friends, and parents lost to fentanyl's grip. The response and recovery. In response to the sweeping devastation, communities and policymakers have begun to fight back. Awareness campaigns, tighter prescription controls, and enhanced law enforcement efforts to disrupt fentanyl distribution networks are being implemented. Recovery stories, though hard-earned, are beginning to emerge. Treatment centers adapt to the unique challenges of fentanyl dependency, offering specialized programs and support for those affected. Families and survivors start speaking out, sharing their stories to educate others about the dangers of opioid misuse. A call to vigilance and hope. As the narrative of fentanyl addiction unfolds, it's clear that overcoming this epidemic requires a collective effort. It calls for vigilance from healthcare providers, education for the public, support for recovery programs, and compassion for those struggling. There's a growing sense of hope as communities come together to heal and combat the spread of this deadly drug. Fentanyl addiction is a crisis that touches all corners of society, but together we can make a difference. If you or someone you know is struggling, reach out for help. Remember, you're not alone in this fight. Like, share, and subscribe for more content that matters. Let's continue this important conversation and work together to bring light to the shadows of addiction.